ma'am.
Hello, Mr. Taylor. How are you today?
Good.
Good. My name's Amy. I'm going to be doing your assessment today. What was your purpose in coming for the visit today, sir?
For a physical?
Okay. So you get your physicals every year?
Yes, ma'am.
Good deal. Okay. Well, I noticed that she got, the nurse assistant already got your blood pressure and it was 120/66. So I'm just going to go ahead and get your heart rate and check your respirations and temperature if that's okay with you.
Yes.
I'm going to wash my hands. And some gloves. So how are you doing today?
I'm good.
Were you off work today?
Yes.
So you didn't have to miss work for your physical.
Okay.
Okay, I'm going to hold this on your tongue and get your temperature, please. Check your pulse right here. Hadn't had anything to drink cold lately, have you? Okay, your pulse is good at 66. Looks like your respirations are 19, which is normal. It's beat. It beat. 98 is your temperature, that's good. Have you been having any kind of health problems or any changes in your health since your last exam?
No.
Okay. Okay, I'm just going to ask you a few questions. You're probably going to think I'm crazy, but this is just part of my assessment. Can you tell me what year and month it is?
November 2013.
Exactly, and Thanksgiving is coming up, right?
Yes.
Okay, so my patient is awake, alert, oriented to time, person, place, and situation. So his Glasgow coma scale is 15, which is normal. I'm just going to start off our assessment with hair, skin, and nails, and we're just going to work our way down from top to bottom, okay?
Okay.
So I'm just going to look at your hair. It looks nice and clean and shiny, well groomed, evenly distributed. Your skin is warm and dry. No scars or nose masses or anything abnormal noted. I'm going to look at you, let you hold your hands out for me. Your nails look good, well groomed, clean, short. Capillary refills are less than 3, which is normal. Get good circulation, or warm. And at the level. So your skin looks like it's pretty much even tone, no rashes or anything like that. Let's see. Check your skin turgor. Let's see here. Looks like your skin turgor is good. That just checks for dehydration. You drink plenty of water?
Yes.
Okay. All right, I'm just going to pull your gown down. Now we're going to work our way down. Next, I'm going to assess your head and neck. Head looks like it's setting normal. Your ears are symmetrical. I don't see any drainage. Have you had any ear infections or anything?
No.
Okay. Just look at your nose. It's midline. Can you put one finger over, close your nostril? Can you breathe out of that nose?
Yes.
Okay, do the other one. So no problems with your nose?
No.
I'm just going to palpate your sinuses. Any sinus problems?
No.
Any pain?
No.
Any pain in the ears?
No.
I'm just going to let you open your mouth. I'm going to check you for TMJ and then close back, okay? Good deal. It's like your trachea is midline, your neck has no lesions noted, no masses. Any pain, stiffness in the neck?
No.
Move your neck side to side, up, down. Any pain?
No.
Okay. I'm going to move on to, actually I'm going to go ahead and assess your temporal arteries, which are right here, this part of your head. Palpate. And I'm going to listen with the bell of my stethoscope. listen to your carotid arteries also feel my stethoscope? And those are normal also, no bruise noted. Moving along to your thyroid gland. Have you ever had any thyroid problems that you know of?
No.
Okay. What I'm going to do is I'm going to palpate your thyroid. I got some water here for you to drink. I want you to take a small sip and keep it in your mouth until I tell you to swallow. And then when I tell you to swallow, I'm going to feel your thyroid. Okay, swallow. Okay. Everything seems normal right there. Nothing noticed that's not. Any pain?
No.
Okay. I'm going to check your lymph nodes. You know you have lymph nodes all in your neck region. And we want to make sure that you don't have any kind of masses or anything abnormal like that, okay? So I'm going to start right here. And that's your occipital. And there's nothing noted. I can't palpitate anything on either side, which is good. Then we're going to move along to the anterior cervical. Posterior cervical. Mandibular. Any pain?
No.
Submental. Okay, so nothing's felt on both sides. That's good. I'm going to check. Did you sit up a little bit straighter? I'm going to check right here. Supraclavicle area. Okay, nothing's noted there either. So that's normal. Okay, moving along, we're going to check your eyes. I have this Snellen chart over here on the wall. I'm going to let you stand up. Get this back on. And what this does is check your vision for distance. Should be about 20 feet from it. And you don't wear glasses or contacts, right?
No.
Okay, I'm going to get you to say, can you tell me what line 2 says?
F P
Line 3?
T O Z
Line 4?
L P E D
Line 6?
E D F C Z P
Okay, good. And line 8?
D E F P O T E C.
Okay, good. So that means your vision is 20/20, no abnormalities. You can have a seat. Now what we're going to do is check your vision for near vision, astigmatism. And I'm just going to let you read these off to me. Line 2,
F P
line 3,
T O Z
and line 5.
P E C F D.
Okay, great. Thank you very much. No problems with your eyes. Going to move along to your chest. So I'm going to drop your gown down again. Are you comfortable in here? It's not too cold?
It's fine.
Okay. Alright, so your chest looks symmetrical, the rise and fall is even. It's like your respirations are even, non-labored, no problems breathing, just from looking. Warm and dry, skin's intact, no nodes or nodules or masses noted. Any pain with breathing or coughing or anything going on?
No.
Okay. I'm just going to listen to your chest. Every time I touch my stethoscope to you, just want you to take a deep breath in and out through your mouth for me, okay? Okay, right and upper lobes are clear. and upper lobes are clear anteriorly. Bilateral. Kind of listen to your lateral. Deep breath. Clear. Okay, clear lateral. And I'm going to listen to you from back here. Okay, your bilateral lobes are clear, anterior, posteriorly, and laterally. I'm going to put my palms on you. Every time I do, I want you to repeat 99.
99, 99, 99, 99.
Okay, let's check if we're tactile for images for the feel vibration. If not, there's usually a problem, and I did feel about the vibrations if there's no problems with your airflow. Usually you'll see that abnormalities with patients that have like pneumonia or COPD. Okay, so we're gonna move on to I know you're a male, but have you ever done a self-breast sit down?
No.
Okay, well, I'm going to go over that with you and do a little bit of education because males can, in fact, get breast cancer. You do have breast tissue, not as much as women, but there's just a lot of different techniques that you can look up online. The one I'm going to go over with you is the circular technique. And what I'm going to do is I'm going to have you demonstrate back to me. Actually, let's do it together. You want to start with your fingertips, close to the middle, and you're going to work yourself all the way around, going in a circular motion. And what you're feeling for is lumps, mass, nodules, anything pain, anything that feels like a little bean or anything. And you want to do this all the way around. Actually, you want to hold this arm up and let's do this. Sorry, you want to hold your arm up and do it. Let me do it. Or you can lay on the bed and do it, or you can do it in the shower. You want to do that once a month. You want to make sure you go all the way into this area over here, under your axillary, because there is lymph nodes in there. Any pain or anything?
No.
Okay. Any questions about that?
No.
You think you'll be able to do that?
Yes.
Okay. Okay, next thing that we're going to do is your cardiovascular system. I already checked your carotid pulses, which were up here. Listen to them. There's no groups heard. I'm going to listen to your heart. Any heart problem, any history of heart problems? Okay. I'm going to listen with both sides of my stethoscope. I'll listen with this little bell. This reason I'm going to listen with this side also because it'll let me know if you have a murmur or anything abnormal, okay? So I'm going to repeat this twice with both sides of my stethoscope. Listen to your aortic, which is your second intercostal space on the right side. Pulmonic, second intercostal space on the left side. First point, left side, third intercostal space, sternum border. Tricuspid, which is the left side, fourth intercostal space. Okay, and I hear just S1, S2, which is normal heart sounds. I'm going to listen with my bell, see if I hear any murmurs or anything, okay? Okay, your heart sounds good. Your apical pulse is actually 72. I'm going to check your pulses here on the right side and your brachial. Okay, it's palpable, normal, strong. 71. We'll do your radial on your right side. It's also palpable, strong. Normal. 72. And your left brachial. Palpable also, strong. 73. And your radial here on the left side. Strong, palpable. And the 70s also. I'm going to check your pulses in your legs. Right here. Posterior tibial. You can feel it. Strong, palpable. To your left side. And the posterior tibial, which is down here on your foot. You're able to feel it here on the right side. It's normal, palpable. And your dorsalis pedis, which is on top right here on your right foot. It's strong, palpable. Tibial, popliteal. Strong, palpable, and look, feel it. And then do your dorsalis pedis here on top of your left foot. It's bounding, strong. Okay, also in the 70 range, so that's good. I notice that you don't have any swelling of your feet or legs, any varicose veins. Your skin tone looks good. Feet's warm. That's good because that means you have good circulation. Let's check your arms. Make sure you don't have any kind of swelling. I didn't see any swelling. Okay, so all your extremities are warm and dry. No swelling noted. Good circulation. Okay, so now we're going to move on to your abdomen. Do you have any problems with your abdomen that you know of?
No.
Okay. Do your bowels move regular?
Yes.
When was your last bowel movement?
This morning.
Okay, good. When did you eat last?
An hour ago.
Okay. So listen to your bowel sounds. Right upper quadrant. Kind of hyperactive, probably because you just ate. Left upper quadrant. Right lower quadrant. Left lower quadrant. So bowel sounds are present in all four quadrants. Right now they're kind of hyperactive, probably because you just recently ate. Let's see what I'm just going to listen because you have some major arteries in your abdomen, and I'm going to listen for your aortic artery, which is here under the umbilicus. See if I hear anything. Your renal arteries, which are located in your upper bilateral quadrant. And your iliac arteries, which is located in your bilateral lower quadrant. Okay. Everything sounds normal in your abdomen. I don't see any problems with that. Have you ever had your reflexes checked before?
Yes.
Okay. So what we're going to do is I'm just going to tap in a few different areas just to make sure that your reflexes are present, okay?
Okay.
Just dangle your arm for me. We're going to do either biceps and triceps. Okay. patella, so we just want you to relax your leg. Okay. Sleeping now, okay. Alright, looks like reflexes bilaterally and all extremities are normal. We'll move along to the musculoskeletal system. And what I want to do here is, let's put your gown back on, check your balance, your gait, which is when you stand, how well you do it, and try to see if there's any deficits or anything abnormal. Okay? So what I'm going to have you to do is just stand up straight and close your eyes. Okay, I want you to keep one foot on the ground and bend your other leg at the knee. Okay, other way. Okay, that's good. Okay, you can open your eyes, and what we're going to do now is called a test called the Romberg's test, and I'm going to let you take a few steps to and back, and you want to have your heels, feet to heel, toes to heels. When you do this, I want your hands by your side and I want your eyes closed. I'm checking for balance and coordination, and I'm going to be right here walking beside you, okay?
Okay.
Okay, that's good. You can turn around. Okay, that's good. What I want to do now is check, you can have a seat. I want to check your strength in your arms and your legs, okay? So I'm going to get you to hold your hands up like this, and we're going to push. I want you to push against me. Okay. I want you to grip 2 fingers. Don't hurt me, please. Just grip and checking your strength. Okay? Okay, so your pushes and grips are even and strong in your upper extremity bilaterally. And I'm going to do the same thing with your feet. I'm going to just move back. Push. Okay. And push. Okay. So your lower extremities, strength is good, and equal and strong bilaterally. Let's see here. Now we're going to move along to a part of my assessment that I have to do where I check all of your cranial nerves. We have 12 cranial nerves. I'll always make sure that your patient's cranial nerves are intact. So a few of these we've already done in the assessment. I'm starting with cranial nerve number 1, which is olfactory. That tests your sense of smell. So what I'm going to do is get you to close your eyes. I've got a few items I want you to smell. I want you to close one nostril, smell the item, close the other nostril, smell the item. So I want to make sure both of your nostrils have no deficits. Okay? Okay, so checking your right nares. Can you smell? What was it?
Alcohol.
Okay, let's do your other nares. Did you smell it? Okay. Okay, and I got one more item. Okay.
Perfume.
Okay, other side.
Perfume.
Okay, good. Okay, so your cranial nerve number 1 is intact. You was able to recognize those smells without knowing what they were with your eyes closed, so that's good. Cranial nerve number 2 is your optic nerve. We already basically went over that by checking your vision, distance and close up, and you did well on that, so we don't have to redo that. Cranial nerves, let's see, 3, 4, and 5, the oculomotor, trochlear, and abducens. What I'm going to do is check your 6 fields of cardinal gaze. I'm going to check your pupils and looking for a good accommodation of your eyes and then your extraocular eye movement. So what I want you to do is cover one of your eyes. Okay, and so with your left eye, I want you to follow my pen, okay? Without moving your head. Okay, good. And let's do your other one. Okay, good. So notice nystagmus is noted when I do that. I'm going to check your pupils with my pen light. Just want you to look straight ahead, okay? Okay, pupils are reactive and round to light. They went from 4 millimeters to 2 on both sides. Okay, and then next we're going to go to cranial nerve number 6, which is trigeminal. I want you to see if you can close both of your eyes together. I'm going to touch your face with an object, and I want you to say yes every time that you feel this object, okay?
Yes. 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 Yes.
Okay, and can you tell me what this object is?
Cat.
Okay, good. There's a part that checks for stereognosis, which means I'm going to put something in your hand and I want you to tell me what it is with your eyes closed, okay?
Okay. Quarter.
Okay.
Key.
Okay. Keep your eyes closed. I'm going to put a number on your hand. Can you tell me what it is?
8. 3.
Okay, good. Okay. So that was checking to see if you could recognize objects with your eyes closed. Also, I want to do a taste test, if that's okay with you. I have 2 items here. I'm going to let you close your eyes. And I'm just going to put a little bit on your tongue. Okay, and can you tell me what that is without opening your eyes?
Lemon.
Okay, that's right, it's lemon juice. We'll let you drink a little, we'll keep your eyes closed and let you drink a little water in between. There's one more to taste that's different than lemon, so make sure you can recognize it. Okay, Tony?
Vanilla.
Okay, good. That's right. Okay, so next thing we're going to do is cranial nerve number 7. Just checking facial. I already checked your TMJ, but your facial muscles seem to be strong. I'm going to see if you can smile with your teeth showing, frown, puff your cheeks. Okay, good deal. So cranial nerve number 7 is intact, no deficits noted. Cranial nerve number 8 is vestibulocochlear. That's to check for dizziness, vertigo, coordination, and your balance. When we did the Romberg's test, walking with the toes to heels, that was to check for that. Your coordination seems to be good, so we don't have to repeat that. Cranial nerve number 9 and 10, which is glossopharyngeal, and your vagus nerve. What I'm going to get you to do is hold your mouth open, and I want you to say ah. Okay, so your uvula's midline. That's good. I'm also going to inspect your mouth with my pen light. Just look down your throat, make sure everything looks good. Okay, good. So that cranial nerve's intact, nothing abnormal. Your accessory nerve, which is cranial nerve 11, I want to check the strength in your shoulders and everything. So I'm going to see you shrug your shoulders. Okay, and then I'm going to push resistance in your shrug. Hard. Okay, good. And then I'm going to turn your head from side to side. Okay, and then left. And then right. Okay, any pain or anything when you do that? Okay,
Right.
good. So you got good strength. So your accessory nerve, cranial nerve 11 is normal, no deficits noted. Last cranial nerve is cranial nerve number 12. That's the hypoglossal, and that is where I want you to be able to stick your tongue out and pull it back in, and then stick it out and go side to side with your tongue. good. Do you have any questions, Mr. Taylor?
Ma'am.
Okay, good. Well, thank you, sir. You have a good day.